Hello, this is Dr. Steele. Today I want to talk to you about the 10 most unfortunate causes of us dying. And what I mean by that, I'm talking about health issues. And as I mentioned before, I love treating diabetes. I'm passionate about taking care of our patients, controlling them. But I want to talk about the 10 most common causes of death because they intertwine with diabetes, most of them. So the number one cause of death that you already know is heart disease. Heart disease because diabetes, as you know, the foot is not going fast enough where it needs to go, and the arterial system, those vessels get dirty. What I mean by that, you have plaque formation. The fancy name in medicine is called atherosclerosis. That they get plaque formation because, as you know, to simplify things, sugar is sticky, cholesterol, fats are sticky. If that happens long enough, those vessels are going to get occluded and you may have a heart attack in this case. The second cause of death that I want to remind you that is very common is strokes. The same thing, as I explained, is a vascular disease. So most of our demise are secondary to vascular diseases. The other one that you already know that is a big one is cancer. And cancer is very sneaky. It's not easy to diagnose sometimes. I know that we have a few tests for the most common ones like breast cancer, colon cancer, prostate cancer, and sometimes we have a good test when the patient has risk factors like a smoking history for lung cancer. But we don't have a good test for all cancers. So as I mentioned in my previous videos, we need to listen to our body. But that's a conversation that we already had in another of my videos of the signs and symptoms of cancer. Another one that I wanted to keep in mind is respiratory issues. And respiratory issues is intertwined with sepsis, with infections. And that's why we make a big deal with COVID and now influenza, because those two things can alter not only our respiratory system, but also can lead to sepsis. And sepsis means that the infection went from your lung, in this case, or from any other part of your body where you have an infection, and it has invaded those vessels. And you and I can have a circulatory collapse because those vessels have been infected by that organism, and it's dividing. It's creating certain cytokines, or not cytokines, toxins, that can lead to a circulatory collapse. Another one that we need to keep in mind is, and it's very important, is falling. If you and I, after 50, because I'm already there, lifting, pulling, pushing, climbing, not a good idea. Climbing. Because as we get older, our bones do not heal as fast as they used to. So if we fall, even though we think we're still 20, our body's not 20, it's going to take forever for that body to heal. And that is going to make you stay in bed for a long periods of time if you break your hip. And that can create blood clots, and that blood can create a DVT, deep venous thrombosis that can lead to a pulmonary embolism. In other words, fancy words to say that the lung is going to be affected, the heart cannot beat right, and you and I can die from it. Another reason for death, for dying, that is very common is, of course, accidents, car accidents. Like they say, don't drink and drive, right? Because unfortunately, if you hear in the news, that's a very, very big problem that we have, accidents. Another thing that I want to convey to, as far as the most common reasons for us dying, is, and it's very important, neurodegenerative changes. Neurodegenerative changes. As you know, there's a lot of celebrities that we know, like Michael J. Fox, like now Celine Dion, that they have neurological problems like Muhammad Ali, Parkinson, and so on and so forth. So that's another cause, and it includes Alzheimer's and so on and so forth. Another reason to that is also, and it's big, but it's secondary to diabetes and hypertension. As you know, high blood pressure and having uncontrolled diabetes is kidney failure. I'm sure all of us have a family member or an acquaintance that have a kidney dysfunction and they're going through dialysis. Very frequent problem. But that leads to cardiovascular disease. And again, going back to heart attacks and strokes, is intertwined with that. Another one, of course, we hear a lot, unfortunately, mental problems, right? Like suicide. Suicide is a big one too. And that's another thing that even though we take the steps to not control, but to be aware of that, sometimes the people that are going through that are not sometimes giving a lot of signs and symptoms. And by the time we find out, it's too late. So keep the lines of communication with your family members. But even though that happens, sometimes they don't want you to know that they don't feel the way they should feel. And lastly, I just wanted to remind you there's a lot of things that can happen to us, but they don't happen to us, they happen for us sometimes. And we got to be careful to understand that all of us, as any other vehicle, like a car, like a elevator, like anything, everything needs to be supervised, checked constantly, I was in the military, like a ship. The thing that the ship needs to be not only renewed, constantly. You have to have maintenance to it, but you have to be checking things all the time. The same thing goes for our body. We need to be aware of that. This is our temple, and we need to keep up with checking. And nowadays, we need to go to the doctor or a provider that you feel you can trust for them to be checking on you. Because, as I said before, final point, three things that I focus on my patients. I use the letter P to talk about prevention, and prevention is about prolonging life, doing things to prolong life. I do use the letter D for detecting early as much as we can, because I mentioned that cancer is very sneaky. And I use the letter C at the end for controlling things that we can control, that we know for a fact are going to be detrimental for our longevity. If you have, for instance, high blood pressure, let's control it. High blood sugars, glucose, let's control that. If you have lack of vitamin D, lack of testosterone, lack of thyroid, or lack of anything, we need to supplement that. So that's my talk for today. There's a lot of things that can get us, but it's not about not dying. It's about dying less by prolonging life, as I said before, right? Because none of us are eternal. But if you can get another week, another month, another year, another 10 years of health in life, why not? So take care of yourself, because at the end, I mentioned to you over and over again that the greatest wealth is health.